Welcome to your video guide for travel healthcare. My name is Kay from TravelNursingNewbies.com, and in this video we will be discussing the credentialing process. So come on now and join us. Travel healthcare just got easier.
As a travel nurse, I will rise with the sun, follow the faintest trails, and live the life of a healer. And I trust my friends at RN Network to be there with me every step of the way.
This is not one of our favorite conversations, but it is very, very important that we talk about credentialing. As I said, this is not our favorite. In fact, this is the most pain you're going to have with travel healthcare is getting all of the credentialing stuff ready to go. Because I guarantee you, once you think that you have all your credentials together, you will get a call from the hospital, from your recruiter, saying, hey Kay, we need you to stop and get another drug test. The other one was diluted. And you're like, really? I'm like, okay, so this actually happened to me. I told my recruiter, I said, that's great. I would love to do that. Just find me parking for a 29-foot trailer that I'm pulling behind me. We actually did find a LabCorp that had parking for a 29-foot trailer. So don't be surprised if these things come up. Credentialing is, we have to have it it's a way to protect our license. Also, so it's very important. By knowing what you need, it should be a lot less painful. The official definition of credentialing is evidence and authority, status, rights, and entitlement to privileges, usually in a written form. Now, this could include your nursing school records. The hospitals won't necessarily ask you for this, but if you're going to a new state, the state boards of nursing will ask you for this. Your nursing license information or your therapy licensing information, they want to know that. You'll need your immunization records. The big ones are MMR, varicella, your hepatitis B, and also things like your tuberculosis, your PPDs, chest x-rays, or even your quantiferum gold. Another thing that you need is every year is a physician statement. This is a statement by your physician stating that you are physically and mentally able to do travel nursing. The next thing you need is a skills checklist, and be prepared to do some standardized testing as part of your credentialing. Now, before you're submitted to a hospital, the main things you need is an application, a skills checklist, 2 references, and with some of the vendor management systems, which is a database of jobs, they are now requiring a social security card and a copy of your driver's license. So don't be surprised if those things come up also, because they need your social security number to put in for the submission. But for a submission, all you need is the application, the skills checklist, 2 references, and possibly your driver's license and your social security card. Now, there's going to be some companies that are going to request more stuff from you, but that is a standard minimum of what you need to be submitted for an assignment. Be careful when you get to these companies that they want all this other extra stuff, because to find one assignment, and if you have 10 different companies, then that's going to be a lot of paperwork. And they're going to try to get you to do more paperwork because they want you ready to go. They want you to invest into their company. But these are the 5 things that you really need to get started to have your profile submitted. Your nursing school records. You may need the school to send your company your records, your transcripts. These need to be official transcripts that you have to write to the school from, and the school has to send them to the travel company. They will not accept, a lot of them will not accept photocopied or fax copies. When you go into traveling, you will need your licensing information for the states that you have worked in or the states that you are licensed in. NurseSys is a great system for this. And I'm not clear on the therapies, how they do all of theirs, if they have some kind of a database and that, and I apologize. But I do know that for nurses, you can go to NurseSys and most of your information can be found from there. Now, there are a couple of states, most states you just need like your original and the places that you are licensed now. There are a few states that want every state that you have ever been licensed in. So if you've been a travel nurse for 10, 20 years, that's going to be a lot of states. So you might think about, is it worth getting that much information for just one assignment, or is that a state that you're might want to return to? Another thing with credentialing is that once you've accepted assignment, the first thing they're going to do, because it takes a while, is the criminal background checks or your background checks. They do criminal background checks. The company may have an employment check, whether you've been hired or fired, or they have a whole questionnaire about your nursing experiences, and if you've gotten in trouble with the state, do you have an alcohol problem or a drug problem, if you've been to any mental counseling. There are some companies who will ask all of that also. A new trend in the last 4 or 5 years is they will also ask you for a credit check. The reason for this is that some companies believe that if you're an excellent, great nurse, then you're going to have excellent, great credit, which is not always true, because that's why a lot of people go into travel nursing, so that you can catch up on your credit that you're behind on. I personally don't have a problem with this, but for some nurses, be aware that this does occur with some companies, and you might have a problem with that. I just want you to be aware that a credit check is a possibility. One thing that has to be done before they even submit you is a reference check. You need at least 2 references, and preferably they need to be charge nurses, house supervisors. It can't be like your recruiter, or you might use a recruiter for a third one. But these need to be references from the last hospitals that you have been to. Okay, medical records. What kind of proof of immunity do you need? The most common ones are mumps, measles, rubella, your MMR, varicella, and hepatitis B. The miscellaneous ones that you might need, as we discussed before, was the PPD testing, a chest x-ray, or quantiferum gold. I know for travel nurses, getting the PPD can be a little redundant at times, but it is very important that you have this. I went into a hospital PPD negative. I came out PPD positive. At this time, if I wouldn't have had that first PPD done to prove that I was negative, then I wouldn't have had any legal standing. Now that I have a positive on, now we know where that changed and what hospital it was at. Physician statement. On your physician statement, the stuff that they really need is your height, weight, your vital signs, and are you physically able to lift? This might not be, important maybe with NICU, but for most part, for the rest of us, it's very important that we can able to lift. And for us oldest, I tell you what, I tease the millennials a lot, but you guys have got it made. Let me tell you, they have this last hospital I was at, they have this new thing that you roll the patient on it and then you blow it up and it's bed height and you just roll them over. It's like, man, if they had that 20 years ago, I'd still have a back. So, but you got to be able to do your job. And mentally, you got to be able to do your job. And we've given you lots of great hints on how to prepare for travel nursing, mental-wise. But nursing can be a mental job in itself. You need to have the mental resources to carry you through these jobs. So you have to have a physician to sign off on that. And yes, I've been lucky, and I've had a physician sign me off for the last 15 years. So I'm good to go on that, believe it or not. So some miscellaneous items that you might have to have is your flu shot and then a fit test. You know, the next thing I want to talk about is credentials. Everybody needs at least basic life support. If you're going to be doing anything with a telemetry, ICU, then you must have ACLS, which is Advanced Cardiac Life Support. If you're going to do pediatric nursing or ER, you need PALS. For your neonatal nurses, you need NRP, and even some of you may want to get stable. If you're a labor and delivery nurse, you must have A1. Now, there's two types of A1. There is intermediate and advanced. We prefer for you to get intermediate first. It's a 2-day course, and most hospitals accept that. On very few times I've heard of hospitals only accepting advanced, which is a 1-day course. If you're in the emergency room, they have the pediatric ERMPC, or I don't know, I haven't done that one yet. But they also want you to have, which is your pediatric emergency nursing. And then we also have, for the level 1 centers, you must have your trauma nurse core curriculum, TNCC. If you're in ICU in a smaller hospital, medium to smaller hospital, you may also need TNCC. On all these certifications, you must have copies of the front and the back sides, and they must be signed. You know, the next thing I want to talk about is taxes and the forms you have to fill out for that. It is the responsibility of your company to make a reasonable determination that you are actually traveling away from your home so that you can have your housing stipends, your reimbursements tax-free. So for this, companies have come up with a tax home declaration status. And no, 50 miles has nothing to do with a tax home declaration, because even though sometimes we like to spend money like we're in Congress, we are not in Congress. Therefore, there is no 50-mile rule, because those are the only people who have the 50-mile rule is a congressman. For travel nurses and travel therapists, we must be far enough away from home that we are required to stay the night at the assignment location for us to properly do our jobs. Another thing we need to do is we need to be duplicating expenses. You have to, at your tax home, tax residence, now that is two different things, but at your tax home, you need to be paying mortgage, rent, upkeep on a house. You can pay your parents also to rent a room. You can rent a room for your parents. That's totally acceptable as long as they declare that as income. And you have to have a paper trail also. So, but these companies need to make a reasonable, have a reasonable documentation that you really do have a tax home. So these travel stipends are reimbursements for duplicating expenses and therefore are tax-free. You also may have to do a travel reimbursement statement, which means that I'm going from Grace, Idaho to Tillamook, Oregon, and it's this many miles, and your company will pay you 25 cents a mile, or they'll pay you $250 a flat rate for that trip. But to receive this reimbursement, the companies now will have started making you have a travel reimbursement statement. Next, we're going to talk to the payroll ladies or men. They are going to want a W-4 from you, which has all your withholding information. If you're single, married with joint custody or filing joint, there we go. If you're married, filing joint, married, filing separately, they need to know all that. Also, it's very important that payroll has your direct deposit information so that they can zap that money right into that account and you don't have to have a paper check. Testing. This is another one that you're like, oh, why am I doing travel healthcare? I got all these tests to do. Yes, it's part of travel healthcare. There's some companies, hospital systems, that will send you 60 modules to do. You need to be aware of this, that it is a possibility that you have this. You need to discuss with your recruiter any payment options. Yes, we should be paid for our time, but in some contracts, in some hospital contracts, the company isn't getting paid for your orientation or your modules. Therefore, the company has to find some other source. They don't have that resource to pay you. So unless they do some creative financing and they've got to look at the whole 13 weeks together, unless they do that, then you might not get paid for your orientation or your modules. It's very important to discuss this with your recruiter whenever you get all this stuff. And if you can remember, this really needs to be talked to and talked about before you sign that contract. Be ready to do all your HIPAA and your fire safety and educational models will probably be online. Prophecy is a big one. The prophecy testing and nursetesting.com. Those are some of the sites that they use for all that credentialing. Your beginning testing may include a competency exam, and yes, we've all passed the NCLEX, but hospitals want to know that you're still competent to practice your art of nursing or therapy. And it also may include, for nursing, it may also include a medication exam. If you're lucky, you'll get medications that you use on med-surg tele, ICU. You can get the other medications that, the presamides and pressors and all that stuff, fancy stuff, the milk of amnesia that you guys use. But for med-surg tele, you need to be up to date on your medications and even the new medications. And they still want us to do drip rates, which I have not done a drip rate at a hospital for a very long time. But you still need to know what the formula is for your drip rates, and especially for your ICU nurses. You might use it in the ICU or ER, but they still haven't gotten rid of drip rates. So be prepared for that. Once you get to the hospital, you think, oh goody, phew, credentialing's done. Wrong. When you get to the hospital, be prepared for more testing, because we love testing. They want to make sure that you're competent to do your job. The most common at the hospitals is they're going to do an EKG testing and another medication testing. You're liable to see those two. We have a BCAT, which is a basic knowledge assessment tool that is used for a couple of hospital systems, and it is a testing of just what you should know as a basic knowledge. Now they do have ICU test, med-surg, tele-test. I don't know about labor and delivery and OB, and I think they have one for ER, but those are more modality specific. And then there's the big one, the PBDS. The PBDS is a whole different animal. It's a performance-based diagnostic system. Originally, they were supposed to take what you missed and tailor an orientation for you. Unfortunately, somebody got the bright idea of using it to weed out travelers. That's not the intent and purpose of this diagnostic testing system. I personally have boycotted this test. I will not take it. It asks you to diagnose a patient also, so that you can anticipate what the doctor is going to order. And there's quite a few of us who will not take this test. Is it a bad test? Not really. It's just be aware that there are hospitals who are still using this test, and you need to look it up and make sure that your recruiter knows whether or not you're going to take this PBDS. test, because it can throw you for a big loop, because this is a pass or fail test. There's just, and some hospitals, there's no getting around it. So be sure that your recruiter knows, ask them every time, am I going to have to take the PBDS testing? You know, credentialing is so important so that we protect our integrity as nurses and our competence, and to prove that we really do know what we're talking about. To tell you the truth, yes, it's a big pain when you're starting an assignment, but it is something that is necessary to protect us, the travel nurses who are in this, because we love the adventure, we love taking care of patients. So, yeah, not the funnest part of travel nursing or in travel healthcare, but it is there, and hopefully after this you are more prepared for what you need for credentialing, and you can go in it with your eyes wide open instead of wandering around in the dark. So if you have any more questions, you know, I'm always on the Travel Nursing Newbies group. You can come there and ask me more questions about credentialing if you have them, and I have some excellent resources. So till next time, see y'all.